Kia ora. I'm Ed Gane and I'm Adjunct Professor of Medicine here at the University of Auckland. I guess you could say that my career followed that of the Hepatitis C virus. In my final year of training in gastroenterology here in Auckland, a new RNA virus was discovered in the serum of a patient with transfusion-acquired non-A non-B hepatitis using a new complementary DNA technology. This new virus was named the Hepatitis C virus, and it was soon shown to be the cause of all non-A non-B hepatitis in injecting drug users. The next year, I took up a research fellowship at the King's College in London to study this new virus. After training in what was then a new PCR technology in Switzerland, I tested archived blood from more than 1,000 patients who had been transplanted for unknown liver diseases. And surprise, we found that almost all of these were infected with hepatitis C. This work was published in the New England Journal of Medicine, and our results refuted an earlier report in the same journal which claimed that hepatitis C did not cause severe liver disease and did not increase mortality. The real impact of this hepatitis C epidemic became clear over the next decade, as this was recognised as the leading cause of liver cancer and liver transplant all over the globe, including here in Aotearoa. When I returned to Auckland in the late 1990s, the only treatment available for hepatitis C was interferon. It was inconvenient, 3 times a week injections, it was poorly tolerated, and it was ineffective. After a year of misery, less than 10% of patients were cured, so no one was lining up to be treated with this. By 2008, the first oral antiviral agents had been developed that could inhibit hepatitis C in the lab. Unfortunately, when given to patients, they rapidly failed because of the rapid emergence of drug resistance. The biggest breakthrough for hepatitis C treatment occurred in 2010, when a small biotech company called Pharmacet approached me to conduct a trial with a newly discovered antiviral PSI 7977, which we now know as sofosbuvir. This was the first oral nucleoside polymerase inhibitor. It worked for all strains of hepatitis C and had a very high barrier to resistance. In our electron study, I treated 40 patients with sofosbuvir for 12 weeks and all 40 were cured. The first time anyone in the world had been cured without interferon. These results caused quite a stir when I presented them at the International Liver Meeting in San Francisco in 2011. Over the next decade, sofosbuvir has been prescribed to more than 10 million people. To date, almost 15,000 Kiwis have been cured with oral drugs. In 2016, recognising the potential of sofosbuvir, all 194 countries of the World Health Assembly agreed to eliminate hepatitis C by 2030, making this the first infectious disease to be eradicated without a vaccine. We can look at Egypt to see what can be achieved with government support. Almost 20% of their population were infected, and in 2018, the Egyptian government set up a national testing program linked with locally produced generic oral drugs. Over the next 4 years, more than 4 million Egyptians were cured, and this country is now the first to achieve the WHO elimination goals. The challenge back here in Aotearoa is to find more than 30,000 Kiwis who are living with hepatitis C, most of whom don't know that they are infected. In July 2021, Minister Verrill and I launched the first National Hepatitis C Action Plan for Aotearoa, New Zealand. This is designed to promote innovative programs to increase testing and treatment in our communities. Over the last 18 months, more than 11,000 finger prick tests have been performed by Māori health providers, needle exchanges, addiction centres and prisons across Samotu. To improve community access to treatment, we're now working with MedSafe to allow nurses and pharmacists to treat hepatitis C. We are making progress. In 2015, more than half of all adults needing liver transplant in this country had hepatitis C. Last year, this was less than 10%, and within the next decade, this will disappear, thereby improving access for patients with other liver diseases to have liver transplants. So I reflect on the fact that hepatitis C was discovered in 1989. We had a universal cure developed within 25 years, and global eradication is very likely within 50 years. A truly remarkable and unprecedented feat. And with this, the number of people dying from hepatitis C will decrease from more than 1 million per year to nil. It was therefore entirely appropriate that in 2020, the Nobel Prize for Medicine went to Harvey Alter, Charlie Rice, and Mike Houghton, the 3 scientists who first identified this virus. When we've eradicated hepatitis C, our next goal will be finding a cure for hepatitis B. Thank you.